My name is Claire Kantrow. I'm a physical therapist and wellness provider here in Baton Rouge. I have a specialty practice in management of patients in chronic pain, and I also do some teaching as an adjunct instructor in the physical therapy program at Franciscan University of Our Lady, which is Fran Yu's new DPT program. I think it's really important that people truly understand what their pain experience is, and it's different for acute versus chronic or persistent pain. So when we look at acute pain is a true reflection of what's happening in the tissue. So meaning either I get bumped, scraped, strained, sprained, something like that that's happening in the tissue. That message is being sent through the nervous system and up to the brain, and the output is some pain experience. And that's all a good alarm system to let us know what's happening in the body. On the other hand, chronic pain, or what we call central sensitization, means that the nervous system, so that pathway of the sensory input from the tissue up to the brain, becomes more sensitized. It becomes better at alerting us of what's going on in the tissue. So it's a little bit different to manage a patient with persistent or chronic pain than it is with someone with acute pain. What's really important too that patients understand is their pain experience is unique to them. It has to do with every experience that they've had in their life, all the traumas that they've had that add up over time and make their nervous system better at alerting to dangers in the environment. When we manage patients with persistent pain or chronic pain, there's 4 things that we really kind of hone in and focus on. The first one is kind of what we're doing here is pain education or pain neuroscience education. Number 2 is techniques to calm or downregulate the central nervous system. A third thing is something we call retraining the brain. And then finally, the last thing is restoring balance to the system. In every pain experience, and whether this is acute or chronic, but much more so in a chronic or persistent pain situation, the central nervous system is really involved. And most people have heard of kind of a stress response we call the flight or fight response. This is part of our sympathetic nervous system. So when our body is perceiving some sort of threat in our environment, our central nervous system kicks on and we go into that sympathetic fight or flight. So we're designed to, when we feel a threat in our environment, to either fight for our lives or run for our lives. And so there's a big connection between persistent pain, chronic pain, with a heightened level of sympathetic overdrive. So some of those techniques to kind of calm and downregulate the central nervous system would be meditation or mindful practice or breathing exercises or anything that's very soothing to the system. And that's different for everyone. So what I always tell patients is, what are the things that bring you joy? Those are the things that to find 5 to 10 minutes a day to add those things into your life. It's sort of the things that turn on our right brain, so our creative side. People love to cook, or they love to be in their garden, or they love to color, or anything like that. That's a great way to sort of downregulate the system and bring some quiet back to that sympathetic response. The opposite of the sympathetic nervous system is the parasympathetic, which is a place of rest and digest. So that's the baseline level that we're trying to get back to with some of these techniques. So there's a few ways that we retrain the brain, and the reason this is something that's so effective in a persistent pain patient is something called neuroplasticity. This is an amazing thing that our body does and our brain and central nervous system do to adapt to different environments. This is why if we're picking up a new instrument and we start learning how to play, we get better and better over time the more our system feels how to do those certain movements. Okay, so that's what we call neuroplasticity. The dark side of neuroplasticity is pain, or persistent pain. And basically what ends up happening is our nervous system, so from the periphery, the sensory receptors that we have all throughout our system, within our body, on our body, are bringing messages through the system up to the brain. And that system, that nervous system, our nerves, our spinal cord, and even our brain can become better at adapting or better at picking up on threats in the environment. We call that central sensitization. So when you have a sensitized system, we have to retrain all of those mechanisms to not be so reactive to threats that are not really actually threats. They're more benign issues. So a few ways to retrain the brain. One is called laterality. So what we find with patients in a persistent pain environment, they have trouble distinguishing between left and right in the body. And so what we do is we have flashcards, or there's apps on the phone that all help with left and right discrimination. So it's just looking at a card of a hand doing a certain position and being able to recognize that's a right hand, that's a left hand. A second thing is visualization, or what we call graded motor imagery. So if we know that a patient goes to get up out of a chair and that's painful every time they do that, we teach them ways that they can visualize how to do a certain activity that would otherwise be painful, and doing it well with good form and without pain. So this goes back to performance athletes, all of that kind of stuff. People have done visualization throughout the ages on being able to help retrain their system. So that's graded motor imagery. Another one is mirror therapy. So lots of people have heard of this with patients who have residual limb pain or issues like that. But the idea is that we put the painful side, so say it's a painful left hand, we put that kind of in a box or behind a mirror. And then we have their good, non-painful right hand in front of the mirror, and they can see into the mirror what looks to be a healthy right and left hand. And then as they're doing that, we have them doing, squeezing a ball or tapping their fingers or doing different things, and letting the brain look at that hand in the mirror as if it's a healthy left hand. And that helps to kind of retrain the system. Very, very cool stuff. Finally, there's a technique called graded exposure. So if we use the example of getting up out of a chair is painful, what we do is we take that task of simply getting up out of a chair and we break it down into its component parts. So a patient who's got shooting back pain every time they stand up out of a chair, I'll have them say, okay, that's first for about 10 reps in a nice, calm, controlled way. We're just gonna lean forward in our chair, back and forth like that. So that's a way to say, okay, we're going to take that whole task that's normally really painful, and we're going to show the brain that it's safe to be able to do those tasks. So you do about 10 to 15 reps of that leaning forward and back, and then you add the second component, which is kind of lifting your buttock up off the chair and then right back down. And you're doing that over and over and over. And what it's doing is it's showing the brain, it's sort of dusting the cobwebs off of the brain that has been not doing that sit to stand because it's been so painful, and it's retraining the brain and showing these different areas of the body that it can do these activities safely and without sending off alarm signals. So some of the actual techniques that we use to kind of restore balance to the system and flood the system with good input is something like yoga or very gentle movement exercises. So, people are often, when they're in pain, the idea of exercising is really, it's a hard sell. But the idea is to introduce some very therapeutic, some very gentle movements that floods the system with that really good input. So yoga is wonderful, aquatic therapy is wonderful, Tai Chi, those sort of very gentle practices that incorporate some of the nice breathing components and incorporate some of that central nervous system calming stuff. Another one is myofascial stretching, so being able to hold stretches and positions for longer periods of time. It looks a lot like yoga, and finding that you can move well in all directions. So a lot of times people kind of get wound up in positions of comfort, especially when they're in a lot of pain. What we want to do is teach them that they can move well and that those positions of comfort can be a bunch of different positions and not just in this one narrow. So that's how they sort of get tunnel vision in this one position. And so we're wanting to try to open up their body to expose them to really positive influences in the environment that won't trigger that same alarm system. I think the main take-home message that we want people to understand is that medications and procedures are not the only answer. There is a lot of really incredible mind-body wellness tools that can help a person's pain experience and can kind of change and improve their pain experience and their quality of life. And that's what we want to do in order to sort of fight this opioid crisis that we've found ourselves in, is equip patients with lots of tools outside of medication that can really change their system for the better.